I've been told this moment hits you, and you're really not prepared for it, and it's true. But thank you for that acknowledgement. Thank you, Dr. Pollack. I've appreciated all the work you've done over the year. Dr. Bax, Dr. Pollack, Dr. Graham, Dr. Axe, Dr. Cooper, Dr. McDade, Mr. Lerner, Mr. King, and if I've forgotten anybody, I apologize, delegates, alternate delegates, and all of our distinguished guests. Thank you for getting up early on a Sunday morning in April to carry on our time-honored traditions at our annual meeting of the House of Delegates. I am truly grateful and humbled by the trust and confidence you place in me to lead and carry out the mission of the Illinois State Medical Society this year. Over the next few minutes, I would like to outline how I see Illinois ISMS responding to the challenging healthcare environment that, like it or not, is changing. I believe that our response will help determine the viability of our medical society over the next few years. First of all, though, I need to thank my family for being here and supporting me through all the years of training, practice, and with my active engagement in professional and community organizations. All of us physicians in the room today know the sacrifice of time and treasure our loved ones have given to allow us the freedom to care for our patients, participate in professional societies, and pursue lifelong learning. Thank you to the Chicago Medical Society, where I first became engaged as a member and later as a counselor, trustee, and officer. CMS is where I first learned of the vital role that the county, state, and national medical societies play in being advocates for all physicians and their patients. Thanks are also are in order to the ISMS, where I served for many years on the CME Accreditation Committee. As a CME site surveyor, I first had the opportunity to witness the significant roles that medical staffs play in planning and executing high-quality continuing medical education. I also got a taste of the tremendous variety of physicians and hospitals across Illinois. And it's here at the annual House of Delegates of the Illinois State Medical Society that I got engaged in the policy development of our society through our grassroots democratic process of deliberating on resolutions. It's been a privilege and a learning opportunity to be a delegate, trustee, and officer for your ISMS. In addition to my involvement with the ISMS, I also serve in leadership capacities for the National Kidney Foundation's Illinois affiliate and for Washington Square Health Foundation, a charitable health trust. I was asked to represent ISMS on the NKFI board by Dr. Kobler when he was chair, in order to further the goal of improving organ donation and procurement in the state. And perhaps you've seen the kidney mobile that the NKF sponsors in your town, parked by a church, community center, or hospital. The kidney mobile travels several thousand miles each year throughout the state, screening individuals for hypertension, diabetes, and kidney disease. Many people first become aware of their risk for developing chronic kidney disease through these free screenings. I'm president and the chair of the grant committee of the Washington Square Health Foundation, a private, nonprofit healthcare charitable organization. The mission of Washington Square is to fund grant requests that promote and maintain access to adequate health care for all the people in the Chicagoland area, regardless of race, sex, creed, or financial need. Through my service on both of these boards, I've witnessed an increasing challenge to provide basic, I emphasize basic, healthcare services to a widening population of citizens. From these duties, I can tell you that ISMS is not alone in dealing with the ripples of change in healthcare. Different ways of doing things, competition for resources, and engaging the public or members are shared challenges, but also opportunities to demonstrate value. I've also witnessed firsthand the rupture of relations that occur when a hospital closes. The money to fund Washington Square came from the sale and subsequent shutdown of Henrotin Hospital, a 200-bed community hospital on the near north side of Chicago, where I was a medical staff member for 10 years. And there are several people in this house that were also on the staff at Henrotin Hospital. I also lived through the closure of Ravenswood Hospital and Medical Center in 2003. And I know Dr. Swaminathan was with me on that endeavor as well. I know the feelings of dislocation and isolation when trusted physician colleagues and consultants are forced to relocate and establish new relations. I know the disruption to a practice when patient referrals are changed and you need to learn new staffs and systems. I've learned that medical staffs, patients, and hospitals are not fungible entities that can be moved around like pieces on a chessboard. Unfortunately, some proponents of healthcare reform have not learned this lesson. So, as your president, what should you expect and indeed demand of me over the next year? Well, first of all, let's briefly assess our challenges. Sir Winston Churchill's first volume on the Second World War is titled The Gathering Storm. The Gathering Storm. That seems to be an apt description of the current atmosphere in healthcare. Scanning the healthcare environment, we see the challenge to the historic and controversial Affordable Care Act of 2010, a sluggish economic recovery from a recent and severe recession, shrinking physician income, and I'm going to come back to that, an unfulfilled need for meaningful medical liability reform, severe funding threats for Medicare and Medicaid, timed to occur during periods when more individuals will be enrolled in those programs, major delays in payment for thousands of state employees that we treat, threats to physician autonomy in this time of increasing employment, shortages of essential pharmaceuticals, continued attempts to encroach on the practice of medicine by non-physicians seeking to expand their scopes of practice, an insufficient supply of primary care physicians, inadequate support for training of healthcare professionals. And while I was reciting this list, you probably were ticking off your own list of challenges that you see healthcare facing today. So, are we witnessing the collapse of the American healthcare system, or a call to arms to defend what is working and perhaps sometimes what is not? And while we may not be in a time of cataclysmic struggle like a world war, it sure can seem like we are facing tremendous forces to change business as usual in healthcare. So, with the storm clouds on the horizon and the winds of change already blowing, what can we as the Illinois State Medical Society do? And I emphasize we. For now, I am your representative to all audiences seeking the point of view of Illinois doctors. First of all, I need your input. During my tenure as president of the Chicago Medical Society, with the help from the board, leadership, and staff, I deliberately reached out to all the physicians in Cook County. Outreach came in the forms of a president's blog and town hall meetings. That came during the time of the healthcare reform debate and allowed for member input on the then proposed legislation. I intend to work to develop and strengthen more immediate methods of communication on vital issues facing us today. Technology allows us to quickly and efficiently survey our members on the topic of the day, and so messages can be crafted reflecting what doctors are thinking right now. And those of you who were in the strategic planning conference yesterday afternoon heard communication that's timely and relevant to members come out as something we really need to address in the coming year. I've also been visiting various venues around the state, and it's always an educational experience to meet with medical staffs and county medical societies to hear the local issues. I look forward to more of these opportunities during my president's tour. Throughout the assault on England during World War II, Churchill sought to unite the country by appealing to the strength and resolve of its citizens. I also intend to tap into what unites us as physicians and not what divides us. Certainly our common experience in medical school, internship, residency, fellowship, that has shaped us into the clinically astute clinicians that we are today. And we need to continue to be passionate about the needs of our patients in a time of diminishing resources and productivity pressures. We all have stories about the impact that changing healthcare delivery and payment systems are having on our practices and patients. I look forward to hearing these stories, and I want to know about your advocacy to protect patients, and as we were all trained, to preserve the focus on that patient and family before us in the exam room, the emergency department, or the operating room. We can be proud that ISMS has played a role as an advocate for patients. One strong example is what our society has done to address sensitive end-of-life issues, working to ensure that our patients are treated with dignity and respect. Through this House, we have developed policies to support patients in making their choices, and we've developed widely used tools and resources that allow them to exercise those choices. Our A Personal Decision book is used in physician offices and hospitals around the state. This simple resource has made a difference in people's lives, and this is only one example of how we serve our patients through the society. We should be proud. I believe that we can be united and not divided by healthcare reform, regardless of the fate of the Affordable Care Act. Whatever happens to the ACA, there is going to be opportunity for ISMS to assume a leadership role, like we did in 2009, to educate and be an advocate for our members and patients. Medicine has become a team sport. with physicians leading teams of physician assistants, nurse practitioners, pharmacists, patient navigators, and others. ISMS needs to be a resource for physicians in this evolving model of healthcare delivery, especially as more of us work in large groups or are employed by hospitals and health systems. ISMS health reform universities held last year are a great example of how we can reach out to physicians throughout Illinois. However, another storm cloud that has been affecting every one of us is diminishing physician reimbursement. You may have seen an article in last month's Wall Street Journal with the provocative title, Why American Doctors Are Struggling to Make Ends Meet. Why American doctors are struggling to make ends meet. The story highlights a well-run, successful Denver area clinic. The group made significant practice upgrades such as an EMR and instituted patient care coordination and outreach systems to meet the requirements to qualify as a medical home. By most reasonable analyses, the clinic was making the necessary efforts to keep up with the payer, regulatory, and patient expectations. These were points that were made yesterday during our lunchtime discussion about technology and the impact that it's having on our practices. And yet, the current reimbursement system is not adequately paying practices to cover the costs of these enhancements. The Denver clinic featured in the article was unprofitable in 2010 and barely inched into the black in 2011. During this time of potential transition from traditional fee-for-service to value-based purchasing, we need to be able to help physicians preserve their financial base. This time of change is called the middle game, M-I-D-D-L-E, the middle game, as physicians and hospitals are transitioning from traditional fee-for-service that rewards volume to value-based purchasing that is based on quality and outcomes. Physicians need the knowledge and the resources to navigate this middle game balancing act. This means managing participation in accountable care organizations and shared savings programs while also generating sufficient income to maintain a practice. Frankly, the challenge is to run an efficient practice, being nimble enough to participate in new delivery and payment schemes while backfilling enough patients to generate an income stream. Physicians need to be able to answer the question, what performance priorities will drive growth and value in my practice? And increasingly, we will need to demonstrate that patients are not only getting the care they need the care that they get. We already provide physicians with free or low-cost practice management assistance through their membership. Health Reform University, our work comp meeting series, the monthly webinars that many of you participate in, our EMR updates, these are but a few examples. If that's not enough, any member can pick up the phone for advice on practice issues or problems. A consultant would cost thousands, but our services are free if you are a member. ISMS needs to be the voice for all physicians, especially on the matter of Medicaid reimbursement, or lack thereof. Under the federal healthcare reform, coverage to the uninsured and underinsured will be expanded in Illinois to potentially 700,000 to 900,000 new people by 2014. And while the federal government will initially cover the majority of the state's costs of the expanded coverage, eventually the extra federal support is reduced, leaving states on the hook. How will Illinois pay its share when the state is broke? Our state can't keep up with existing Medicaid commitments and is hitting doctors with a double whammy through the self-insured arm of our state employee health plan. We are approaching a 10-month payment delay for the care we give to state employees. Just imagine a mom coming to your office under the plan and learning the joyous news that she is pregnant. She will likely give birth before the obstetrician is even reimbursed for the pregnancy confirmation. What other business is expected to operate under these types of conditions? We can't allow the state to grow the payment cycle so that reimbursement by an infant's first birthday is considered timely payment for the delivery. ISMS is leading the effort to raise awareness of these crises because many of our members are struggling due to state negligence. We need to be in Springfield and in our legislators' offices advocating for adequate and timely payment. Already there is concern with expanded coverage will not be able to find primary care physicians and will overwhelm our emergency departments seeking care. We need to be in Springfield providing leadership on Medicaid reform and committing to prompt payment standards by becoming active participants in the discussion rather than reacting after the fact to draconian measures. I also want to raise an issue that we really have not openly discussed here, namely the care of those wounded warriors returning from the wars in Iraq and Afghanistan. Did you know that up to 40% of our troops in those conflicts are National Guard and Army Reserve? And as such, they are not entitled to health care benefits in the Veterans Administration hospitals and clinics. This is a storm cloud that is already starting to impact our practices and communities. These veterans may be suffering not only visible physical wounds, but also from traumatic brain injury, post-traumatic stress disorder, and other behavioral disorders. We need to be able to recognize and either treat or refer these veterans who have served our country. I will work with ISMS leadership to assist our members in dealing with this new challenge as these soldiers return to civilian life and live and work in our communities. We owe them nothing less. Finally, we need to reach out to both members and non-members throughout the state to raise the awareness of the truly amazing work that our ISMS staff does in Springfield on behalf of all physicians. Ruth Ann and I recently spent a day with Jim Tierney, Allison Burnett, and Aaron O'Brien, our lobbying team, and we witnessed firsthand the respect and the access they have with our legislators on both sides of the aisle. Thousands of bills and amendments are introduced each year in the General Assembly, and our staff reads and analyzes every nuance of each one, the good, the bad, and the ugly. Based on ISMS policy that we develop here in the House, and in coordination with the physicians who would be affected by proposed legislation, our lobbyists inform the legislators and their staffs on the issues and how seemingly well-intentioned efforts could prove harmful to the patients and the physicians of Illinois. After my time in Springfield, I can attest to the value of membership in ISMS and the value we all receive for our dues dollars. This is truly a bright spot in the gathering storm over healthcare. To quote Churchill, "It is no use saying we are doing our best. You have to succeed in doing what is necessary. You have to succeed in doing what is necessary." At this annual meeting, we are doing what is necessary to address the pressing concerns over membership and governance. Thanks go out to Dr. Bax and Dr. Pollack for providing leadership on these difficult issues. We are debating what is necessary to succeed the 21st century as a healthcare professional organization. The answers are not simple, but we need to look to the collective wisdom of House of Delegates, the Board of Trustees, and leadership to lead us through the stormy years ahead for physicians. Thank you, and let's work together over the next year to improve the practice of medicine and the health of our patients. Thank you.